the latest news, updates, and more from the world of health and medicine. This is Medical Minutes.
It is time for our health spotlight with Wish TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams. Dr. Adams, I know there are a couple of stories related to COVID-19 on your mind today. I want to start here. The numbers of reported cases are rising again, and so does that indicate that we are in another wave of COVID in Indiana and in the country?
Well, you're right, Drew. We are seeing the numbers rise in the three biggest states. Texas, cases up 70% in the last week. In Florida, cases up 50%, and in New York, cases up about 30%. And that's correlating with an increase of about 10% in hospitalizations related to COVID nationwide. So we are definitely seeing a summer surge. We've seen that before. It still remains to be seen as to how bad it's going to be in terms of hospitalizations and deaths. The cases are on the rise.
There's a phrase that you're probably going to hear, maybe you already have, people saying, so what if cases are climbing? Nearly everyone has moved on from COVID, and it can be nearly impossible to find a test now anyway.
Well, many people feel like they've moved on from COVID, but unfortunately, COVID hasn't moved on from us. And I often try to help people understand we're not going to go back to a place where we're shutting down schools or where we're having mask mandates everywhere. But it doesn't mean that we can't protect ourselves when we do see a surge coming, particularly if we're vulnerable. So knowing that cases are rising will allow people who have comorbidities or who are older to take precautions like wearing a mask if they're going to a crowded place or if they're going on flights. And also we want people to understand that if you're feeling symptoms, you still can go in and get Paxlovid. It's still appropriate to go in and get tested and get an antiviral treatment, which can keep you out of the hospital. So there are things that we can do short of, again, completely going back to 2020.
Well, another headline making news today, brain fog and other long COVID symptoms are the focus of a new small treatment study. This could lead to big changes in how doctors treat millions of people with the mysterious symptoms that just won't go away.
Well, this has been a long time coming, Drew. We've heard people talking about their own personal experiences with long COVID, asking for more research, and we're finally starting to see some studies from NIH looking at possible treatments for long COVID. I've got to tell you, I've been in D.C. and I've heard multiple congressmen telling me that they're suffering from brain fog and symptoms of long COVID. So hopefully we'll start to get a few more answers in terms of actually how we define it and what treatments are going to be effective for people. This could actually be the biggest legacy of COVID. Even with over 1 million people who died, we could have tens of millions of people who are suffering from long COVID symptoms. So we need to figure this out.
Is it surprising to you that we don't have those answers yet?
Well, I'd say it's not surprising to me because you think about a virus like HIV. It took us over a decade to get to a place where we had a definition and where we had testing and where we had treatment. So it takes a long time. We were spoiled because of how rapidly things progressed in 2020 with COVID tests and with COVID vaccines. But we've got to keep our foot on the gas because, again, this is a global pandemic. There are millions of people affected.
This is the Medical Minutes Podcast. Be informed and stay connected for the latest news and information when you like, subscribe, and follow this podcast and discover even more from the All Indiana Podcast Network. Now at allindianapodcast.com.